Thank you. Well, good morning on a beautiful British Columbia day. I want to welcome all of you here today, particularly a couple of my colleagues from the legislature. Adrian Dix is here along with Ralph Sultan. Thank you for joining us. It is a pleasure to be here today for what is, I think, a very exciting announcement, one that demonstrates why British Columbia continues to be a world leader in the fight against HIV/AIDS. And I bring greetings from my colleagues, in particular Dr. Montana from the Premier, who couldn't be here, but I know he's worked very closely with you on this issue that is something he's been very passionate about. As you know, yourself and the Premier have been tireless supporters of the fight against HIV/AIDS, and also an advocate of the Centre of Excellence in HIV/AIDS right here at St. Paul's Hospital. HIV/AIDS is a major challenge in British Columbia, as it is in many parts of the world. Every year, between 350 and 440 new HIV cases have been reported in British Columbia since 1999. And on top of the obvious human suffering that takes place, each new case of HIV costs between $180,000 and $225,000 in direct costs. British Columbia is committed to reducing the spread of HIV/AIDS and ensuring that those infected with HIV have access to the very best care and treatment. In April last year, the Premier announced a commitment to a pilot project to expand access to HIV and AIDS drugs to the street-involved and Aboriginal people in Prince George and Vancouvers Downtown Eastside. Both of these communities are profoundly impacted by HIV/AIDS. And people in the downtown east side in Prince George are more likely to have undiagnosed and untreated HIV. And so today I am pleased to announce the launch of a $48 million four-year pilot called Seek and Treat. Seek and Treat aims to decrease AIDS-related suffering and further prevent the spread of HIV disease. It is estimated that more than 12,000 people in British Columbia are living with HIV, and approximately 27% remain undiagnosed. In the Seek and Treat strategy, health professionals will seek out marginalized individuals and give them the treatment and care that they deserve. Health professionals can help those individuals with a life-saving medication cocktail called highly active antiretroviral therapy, or HAART for short. For British Columbians who know they have HIV/AIDS and are connected to our healthcare system, accessing HAART is relatively straightforward and can have extremely positive outcomes. However, there is a large segment of the at-risk population who are not at all connected to the health system. Through Seek and Treat, we are going to actually go out, diagnose, and support and provide treatment to those people wherever possible. The HIV treatment as prevention approach was developed by the BC Centre for Excellence in HIV/AIDS and has sparked international attention, quite appropriately. The centre, led by Dr. Julio Montana, is Canada's largest HIV/AIDS research and treatment facility. And the centre provides support and treatment services for persons living with HIV, as well as advice and guidance regarding current HIV/AIDS treatment. The centre, I believe, is actually the reason why British Columbia's HIV/AIDS strategy has won international acclaim within the global scientific community. And I really want to take a moment to acknowledge the work, and not just the work, but the passion and leadership of Dr. Julio Montana and all his staff that work at the clinic, and the great work that they do on behalf of British Columbia and around the world. Because the work that you are doing here in British Columbia is not just impacting the lives of British Columbia, but it is having an important impact for thousands and thousands of people around the world because of the discoveries and the progress that's being made right here. Prevention is the cornerstone of the province's HIV/AIDS strategy. Appropriate treatment through seek and treat of the disease will assist in averting new infections. By reaching and engaging more British Columbians living with HIV/AIDS in highly active antiretroviral therapy, not only will better care be provided, but the treatment will also significantly reduce or even eliminate the virus's ability to spread. Seek and Treat hopes to prevent up to 173 new cases. That's potentially savings of $65 million in costs that won't need to be spent because these folks are being appropriately treated through Seek and Treat. I also want to acknowledge the support from Merck. Merck has committed $1.5 million over 3 years to the BC Centre for Excellence in HIV/AIDS to help evaluate Seek and Treat. And I really believe that the rigorous evaluation that is consistently done through the BC Centre for HIV/AIDS is one of the reasons why it enjoys such international notoriety. Because that rigor gives the evidence to policy decision makers to make sure we continue to keep investing in what we know is working. And partnerships like the one between Merck and the BC Centre for Excellence are helping us to ensure that BC continues to lead the world in HIV/AIDS prevention and treatment. Thank you. In BC, we're committed to reducing the spread of HIV/AIDS and ensuring those infected have the access to the very best care and treatment. We are proud to be a global leader in addressing HIV/AIDS as a result of the great leadership and work that I mentioned earlier, and also to be internationally recognized for our research and treatment. Seek and Treat will help us to continue to lead in HIV/AIDS prevention and treatment, and I would now like to invite the leader of this great effort and initiative, Dr. Montana, to help me unveil the poster board, which is going to summarize the Seek and Treat program. So, Dr. Montana, do this together. 1, 2, 3, and over. There we go.